Hello and welcome to our special COVID-19 update program here on Channels Television. I'm Ladi Akiridoluale. Here are the highlights for tonight. Federal government to use bank verification numbers, BVN, for distribution of conditional cash transfers. Environment Minister reveals efforts to decontaminate aircraft, amongst other COVID-19 containment strategies. And United Kingdom finances clinical trials for COVID-19 vaccine this week. We start off in Abuja, where the federal government has said the next set of cash transfers will use the bank verification number BVN to identify bank accounts. The Minister of Humanitarian Affairs and Disaster Management, Sadiya Farouk, said this in responding to questions at the Presidential Task Force briefing on COVID-19. She said the digital measure will be faster and more effective.
We want to really focus on digitalizing this process. So we're using the BVN through the bank accounts, as well as mobile phone networks to identify these poor and vulnerable people in the society. That's going to be faster, and there's going to be transparency and accountability. For the federal government, palliatives is for a minimum of 2 months. That's the package we have for the food relief. And even for the cash transfer, you may recall Mr. President directed that we give 2 months advance payment to these households. So I think we'll be able to adequately cater for these vulnerable groups.
Meanwhile, as part of efforts to control the spread of COVID-19, the Federal Ministry of Environment says it is working with the Nigerian Civil Aviation Authority, the NCAA, and the Federal Airports Authority of Nigeria, FAN, to decontaminate aircraft at the various airports in the country. The Environment Minister, Mohammed Abubakar, also said its Forestry Department is also making organic hand sanitizers for use by security agencies.
We are currently disinfecting 150 high-risk areas, again, around the 774 local government. And our personnel also are in all the states and providing technical support to the state government. In our effort with interagency collaboration, we are partnering with the NCAA and FAN, and we have mapped out 125 aircraft and 13 airports across the country for decontamination and disinfection. The Federal Ministry of Environment, through one of our agencies, the Federal Forestry Research Institute of Nigeria, we are producing hand sanitizers, and these are herbal-based, again for the containment of the virus, and we are distributing this to communities and high-risk areas, security personnel that are in the process of making sure that people comply with the lockdown.
Staying with the Presidential Task Force briefing, the Ministry of Education says it is working with the Ministry of Information to ensure educational contents are transmitted to students currently at home due to COVID-19 on broadcast stations across the country. The Minister of State in the Ministry of Education, Chukwuemeka Nwajiba, also solicits the cooperation of parents regarding efforts put in place to render online services to students staying at home during the lockdown period.
The Ministry of Education, the Directorate of ICT has opened a portal. And in conjunction with UBEC as a coordinating agency, the Malama Damadamu, the Minister of Education, as well as the PAMSEC and all the operators in the ministry, agreed that UBEC will anchor an alliance with all the suburbs in all the states that we fund. And they all would then buy into a programming node. Right now, what has happened is that about 14 or 15 states have already commenced learning via different channels that are available in their states, mostly radio and local TV. What they are running is an approved NERDC curriculum. We are also working with the Ministry of Information through NTA and Federal Radio Corporation to then escalate what they normally have as their education content provision so that they can then provide for everybody. They're still working on that. That's an ongoing program. Our biggest challenge is to reach children who do not have devices and who are the fringes of our communities. And because they do not have that, that is why you see us pressing on with the Federal Radio Corporation and NTA as the last end to that.
And we stay in Abuja, where our correspondent, Kayla Megwa, joins us from our Abuja studios. Good evening, Kayla. We're talking palliatives to start off with this evening. 600,000 poor and vulnerable households in Abuja are in focus, aren't they?
Yes, they are, Ladi. The federal government has started the distribution of palliatives to poor and vulnerable households. That's what they are calling it. 600,000 poor and vulnerable households. And the Minister of State for the Federal Capital Territory, Ramatu Aliyu, is actually flagging this off. And we're seeing that's the target. They've not reached it. They just started this particular sharing of palliatives. So let me go through how they plan on doing it. So the total number... it's part of the efforts they are saying from the government to cushion the effects of the virus, and they're looking at 600,000 households. No actual word yet on how they're going to map this out. You know, that hasn't been made public yet, but it has commenced, and they're saying that the distribution will capture all the poor and vulnerable persons in the Federal Capital Territory, Ladi. So that has started in the nation's capital.
That's probably good news for those who have been waiting for quite a while for this. Now, the other thing that seems to have happened is that mobile courts set up to try the defaulters have been in action, haven't they?
Yes, they have. Now we have mobile courts, right? So, and it's mostly penalties and fines. And I actually took my time to find out how the penalties are being done, because they're giving them a lot of community service. If you go to some parts of the nation's capital, you find people sweeping the streets and whatnot, and they're not the regular cleaners. They're people who are on community service. So let's look at how they're doing it. So violators, if they're found guilty, you know, they'll be fined, and then the vehicles will be impounded, right? And this is for people who violate the sit-at-home order. So you're going to pay 10,000 naira, right? Violating individuals, 10,000 naira with community service for 7 days. Then those with tricycles will pay 7,000 naira, while motorbike operators also pay 7,000 naira as punishment. And then cars that are violating the lockdown, 20,000 naira, and trucks will pay 50,000 naira. And all the penalties will go with 7 days of community service. So any of these categories of people who break the lockdown and are tried by those courts, those are the punishments for them. Now, of course, they're not going to be doing any jail time or anything like that. They're trying to make sure that jails are decongested at this time. But, you know, you'd have to pay a fine, and you'd have to do 7 days community service, depending on what category you belong to. And I think, you know, a lot of people are beginning to go through these punishments in the nation's capital. So some people are beginning to listen. Even though the sit-at-home order is not being adhered to as much anymore. Today, there was a lot of people outside the joint security efforts to stop them from, you know, being on the streets and whatnot. However, those who are being tried by these mobile courts will have to pay these fines and do 7 days of community service, Ladi.
Something else that is happening is that a lot more people are being subjected to community testing, particularly in many of the suburbs, the areas surrounding what we know as Abuja city center.
Absolutely. You're talking about community testing, Ladi. Community testing has shown so much, and it scared a lot of people. It has. Even on social media, you can see people saying, oh, I just saw a siren. There's an ambulance in my neighborhood. Does that mean that there's somebody with this disease in my neighborhood? So, and of course, you heard the Minister of State for Health today saying you should report symptoms and report your neighbors if they have symptoms. So that's something that we have going on as well. People are looking out for anyone who's showing any symptoms of the disease. The NCDC numbers are all over the place. And we're seeing a lot of testing in communities. The good thing about testing in communities is that it's shown shown that it's not only people who went abroad and came back that have these diseases, that have this particular disease, I beg your pardon. It's actually in communities now. Now, that's a problem in the nation's capital because city center is not as crowded as the suburbs. The suburbs, you have people who live 10 people per household. You have people with almost zero electricity. You have people with basic amenities missing. So if those communities happen to have this disease, it will spread really, really fast. And that, I think, has put fear in the minds of a lot of people. So like I said yesterday, many people in the suburbs are not going outside. They're adhering to the sit-at-home order, even though some people are still brazen and, breaking those rules. But I think the community testing has put the fear of God in many. And, let's see how this will help in flattening the curve, Vladi.
Thank you very much, Kayla. At least something is scaring them into obeying the rules. Thank you so much for that update from our Abuja studios, our correspondent. And just stay safe out there, Kayla. Thank you. Now, joining me in the studios is our consultant public health physician, Dr. Leah Roberts. Once again, welcome.
Thank you very much for having me, Ladi.
Now, let me begin from where Kayla stopped, which is the issue of the testing. For the first time since this started, yesterday, Lagos reported no new case.
Well, I would take that
under advisement. Okay, but at least the NCDC did not report.
Yes, it's probable that by the time the NCDC was making the reports, the results hadn't been uploaded
to the site. Okay.
So what we'll probably find is that there's yesterday's and today's being reported.
Now, this issue of community testing and the community spread is now front and center.
Absolutely.
Everybody now seems to appreciate what it involves.
Absolutely.
Is that helpful going forward?
Absolutely helpful going forward. The truth of the matter is we really do have to get an idea of the scope and spread of COVID-19 amongst in the community, because we definitely do have community transmission. And unless we have an idea of what we're dealing with, we won't even be able to put in place strategies and interventions to contain it. So we do have to have, and what we have is an expansion of testing, of sample collection, because the testing is still done in specialized laboratories. So, but we have a lot more places that are now collecting the samples, and we have a lot more volunteers coming forward saying, oh, please test me. And that is going to be helpful in the long run. Truth of the matter is this is the kind of disease, if you look for it, you will find it.
No, but is there not the fear of being swamped? If all those who have one reason or the other to present themselves come out, would the health personnel not find...
Well, we've ramped up our capacity quite a bit, but there will be that fear of being swamped. You can see that in the UK, it's still a problem. In Ghana also, it is still a problem. I believe Dr. Ganiu said we should do side-by-side comparison with countries close to us. But yes, it is a problem, and we will be swamped, and we will still have that situation where we are collecting samples and results are not coming out for quite a while.
Because, again, the centers...
Again, the centers, I mean, the kind of testing that is done, the process of the test is, limited by time and materials. At the end of the day, the game changer is going to be a rapid test whose results we can rely on.
Which hasn't yet presented itself, because we had a medical lab scientist here yesterday, and he still said, well, look...
We haven't got anything. He's very right. We haven't got anything as yet that's been accredited by the NCDC or the WHO, and it's going to be from the medical laboratory lab scientists. But there are tests that are available. I'm looking at the one that they're using at the White House, for example. I mean, if somebody's kind enough to donate that to us here, we will be very...
Now, the Lagos State governor did say yesterday that they intend to prosecute now those who are who are giving wrong information or false medical history to healthcare personnel because of the potential it has both for harming the medical personnel and then, of course,
backfiring on the person itself. However, I will take that on advice, because I now heard the story of the gentleman who eventually then died in Louth. And judging from the story, I can see very easily how information got lost in the process. The truth of the matter is that if we don't have solid electronic medical records, which tracks every bit of information the person gives every single healthcare personnel he comes across, he says something to one doctor, he's not likely to remember to say it again or
in
again,
the exact same way.
In the exact same way. And he will assume that if the doctors are communicating, that information should be passed on. So if the first doctor that saw him had put everything into an electronic medical record, which the second doctor was able to just open and look at, then no information gets lost in translation. So for me, it just sort of underscores the need for us to digitize, you know, health information properly and to have it available at the point of care. So yes, the governor is well within his right to prosecute, but it's suddenly making me think that people are probably not deliberately misinforming. You know, it's just that in the panic and the stress of the moment, things do get dropped.
Now, people like you are now in the front line, and there aren't that many of you.
No, not anymore.
Definitely, this crisis, this health crisis, will require for us to keep all those who are available.
Absolutely.
Because in other places, they're even inviting those who have retired to return.
To return.
And come and help out. Which brings up the issue of welfare.
Yes.
Has the situation improved?
No.
Because we are expecting more people to come forward for testing. We're expecting to see a lot more patients. We're expecting more visits to the isolation centers and so on.
In fact, I've just had the very heartbreaking news that a young lady had to go home because she hasn't tested positive, despite the fact that she's definitely symptomatic. And suddenly, there's no holding space for her. So, you know, we are anticipating these problems. And the issue is that, you know, with the ramped up testing and sample collection and everything, we are going to get a jump in numbers. That's for sure. The good thing, and I must say it over and over and over again, is that we're simply not seeing that descent to severity that is being seen in Europe and the US. So yes, people are going to probably test positive. I mean, if we tested them and they turned up positive, the essence is we now have to develop new strategies for sheltering at home and making sure they can look after themselves at home and not necessarily take walking well, you know, into the isolation centers.
Do you think we should continue to build more and more of these facilities?
When you say build a facility, I'm not talking about the brick and mortar. It's everything that goes into the health system that needs to be strengthened and gaps need to be plugged. We do need to have the personnel. The personnel do need to have the equipment. And, you know, the personnel aren't just the doctors and the nurses. We have to have the medical lab scientists. We must have the pharmacists. We must have the physiotherapists. Then don't forget, we need the biomedical engineers. I mean, all the equipment we're using has to be maintained. Then we need the specialized cleaners. We need the ambulance drivers. We need the paramedics. So it's an entire system of people that need to be put in place. So really, our health system is as strong as the people that work the health system. Because as was shown by the isolation center in Oniko, it only takes 4, 5, 6 days to put up a structure. But the structure in and of itself, without the people, does nothing.
Going forward, we've got a few days left of the current lockdown. What do you want to see?
Certainly a reversal of the lockdown, because the pain of the lockdown has now far exceeded the benefits that we can get out of it. And for most people, the majority of whom live beneath the poverty line, the scare of COVID is nothing compared to the real scare of hunger and starvation and insecurity. I mean, I've got certain workmates of mine who live in a certain area that shall not be named, who are every night doing vigilante to keep their area safe, because there are a lot of women and children, and most of the men on that community were caught outside the community by the lockdown. And so the few that are now, they are literally standing guard.
Dr. Roberts, thank you so much for being with us. It's been a pleasure.
It's been an absolute pleasure.
Thank you very much. We'll take a break, and when we come back, we'll have more on what is happening across the states with regards to COVID-19. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 special. As we did promise before the break, let's take a look at what's happening in some states, starting with Niger in Nigeria's north-central region, where the government insists that all violators of lockdown directives will face the wrath of the law, as 9 persons were convicted today for violating the orders of the state government. Our correspondent, Emperor Simon, has that update.
The lockdown declared by the Niger State government is still very much in place. We've observed an appreciable level of compliance since the lockdown started. Security agencies with their men have been manning checkpoints across the state capital, Minna, to enforce the decision by the state government. The government is also not taking it easy with the citizens. Earlier in the day, we received a press statement from the secretary to the state government saying mobile courts set up by the state government have convicted 9 violators of the lockdown. On Monday, the state government decided to provide window for people to go and restock their homes with foodstuff and other essentials that they will need in the course of the lockdown. We were at the Minna Central Market yesterday and we saw people thronging into the market in what could be described as panic buying.
I don't think it's wrong for the government to make a window open for people to go and restock. I don't think it is wrong. I think it's okay, but all we want is just to be careful and just stay away from, just keep distance.
Even the window is scary, it's scary, but we just have to run and come and get something to eat.
While some appreciate the state government for that decision, others feel it's not a good one, especially at this time when there seems to be an increasing number of cases of COVID-19 across the country. From Minna, Emperor Simon.
Emperor Simon reporting from Minna in Niger State. And we cross over from Niger State to Bauchi State, where our correspondent Hajara Aliu has the update of COVID-19 cases in the northeastern part of the country.
The Northeast seems to be one of the least devastated regions in the country. There are 16 positive cases of COVID-19 in the entire region. This is 50% less than the number in Kano alone. This afternoon, the Bauchi State governor confirmed another case of COVID-19 in Bauchi State, making 8 in Bauchi State, even though the NCDC is yet to update that on its website. So there are 8 cases in Bauchi State, 5 in Gombe and 3 in Borno State. Taraba, Yobe and Adamawa states are yet to record any case of COVID-19. What the governors are worried about at this moment is interstate travels. Most of them have shut their borders, but people still find their way into the state. Some of them sneak off-road into the state. The Gombe State governor in particular has been blowing hot about lax security at the border areas.
We shall track and find out where they are associated with and close down those places. And beyond that, we'll close down any local government that hosts such people. And above that, if care is not taken and the spread continues, we'll lock down the state 100% and not allow anybody to come into Gombe State.
The Bauchi State governor is also worried about importation of the virus. The recent case that was confirmed in Bauchi State has a travel history to Kano. And then the recent cases in Gombe State too have travel histories to Kano and Lagos State. And we understand that one of the persons that tested positive in Gombe State has returned to his hometown, Biu, Borno State, where he's from. But he has been traced and then handed over to the task force. What the state governors are looking at is a more stringent measure that will contain the spread of the virus. And they're looking at the possibility of a lockdown. But this cannot be done without engaging stakeholders on this, especially the traditional rulers. The traditional rulers are closer to the people. They can talk to the people, and then they can strategize on ways to impose a lockdown with minimal resistance from the people. From Bauchi State, Northeast Nigeria, Hajara Aliu.
Hajara Aliu reporting from Bauchi, the capital of Bauchi State. Now, to take a look at COVID-19 and its effects on the mental health of patients, health workers, and the general populace, I'm being joined by a consultant psychiatrist with the Federal Neuropsychiatric Hospital in Yaba, Lagos, Dr. Arit Sangbedo. Thank you so much for being with us.
Thank you very much for having me.
Now, it would appear as if while we're busy looking for containment strategies, while we're looking at vaccines, possibility of cure and all of that, we've left this area which has already manifested in things like increased rate of domestic violence and so on, from people who are not used to being at such close proximity. What's our situation with regards to the mental state of those who have been on lockdown of various forms at this point?
Okay, well, it varies. You know, people react to different situations differently because we are all different human beings. People that have been going about their business is all of a sudden asked to stay at home. A lot of things can come out of that. Anxiety over business failing, over loss of jobs. And even those that had pre-existing mental illnesses or chronic illnesses, you find out that that will become more because you have a lot of worries on your mind. So there's a problem with that on its own. Now, even sitting down in the lockdown, I mean, in a space that you've not been used to, that's a problem too. Someone that is used to waking up, going out to do something, and then coming back, and all of a sudden you're telling me, sit down, just sit there, and it becomes a problem. Worry, anxiety, fear. 1 minute you're happy that, okay, I have time. All of a sudden I'm not going to work, that's fine. The next minute you're like, oh God, I don't want this, I want to go back to work. So there's mixed feeling for all this, and this isn't so good for the mental health. We all know that there's no health without mental health. So right now, the lockdown has its good, it has its bad. For families united, you know, you can do things together, do fun things together. But at the same time, I don't think it's really doing what it's supposed to do because people are really getting anxious. You have more people turning out, using substances, using alcohol more because they are fearful of tomorrow. They don't know I mean, this thing just looks as if it will never end. There was one lockdown 2 weeks now, another lockdown 2 weeks. Tomorrow they might say another lockdown. So it looks like it's never going to end. So it's getting people really worried. Anxiety levels are high. And then talk of people that probably had a job after recovery from maybe a mental illness, and then you're telling them now that there's no job anymore. And you're telling me that I have to be able to do something. There must be a role I must achieve in my environment, and all of a sudden I can't fulfill it. So when this lockdown is over, we're going to see a lot of that, as exhibition of mental illnesses. You're going to see new cases of mental illnesses because people will just find out that they can't fit in anywhere. And that's going to be another problem for us because we're going to see a lot of people.
Is this what is manifesting itself in some of the reported cases we have of domestic violence, altercations between people who have been forced by geography to be very close, getting on each other's nerves is what the common parlance.
Exactly, that's true. In some situations, you have a situation where maybe two people were just trying to cohabit peacefully because this one wakes up, goes to work, and then we come back. We are tired, we just discuss the whole day's event and go. Then all of a sudden you're sitting down together, you get easily irritable. Your anxiety levels is so high, your fearful level is so high that your partner could just say something, and you get so angry and now act out by probably hitting. Yes, there's an increase in that. So now we are advocating that when you feel that way, when family members annoy you, because they will annoy you, they'll upset you, don't raise the debate. Step back, deep breathing exercises, walk around, maybe listen to music, that will help you and then calm down. And then there's some helplines that people, a lot of people are really proactive, putting out helplines there. You can call, speak to them, talk about your fears, talk about your anxiety. That helps. And once more, I'm going to say, if you're using alcohol before, do not. If you're using any other substance, do not. Because you become a progressive user, and that's treating another illness. And that's not going to go well with us.
And probably that will also not help your immunity fight against what it is that was the reason why you were kept at home.
Because one of the underlying causes of death is smoking,
respiratory difficulties.
Exactly. So stay away from all those things. So all those helplines, call, talk to people. You can reach out to friends, social media, all these Zoom, virtual, you can reach out and talk. Do fun things together with your family, it will help. Like, I've seen some family playing games with their children, Monopoly, board games, physical exercises, spiritual exercises, you know. Just try to take a back seat when you feel angry, when the fears, when the anxiety is so overwhelming. Take a deep breath, take a back seat, talk to someone, and I think you'll be able to overcome it. And by the time the lockdown is over, let's see how it goes.
Would you be advocating that the way that things are being wrapped up for COVID-19, we should also do the same for our mental health facilities? Because, as you say, we might be expecting more of this.
Even as it is now, I'm sure, because people had pre-existing mental health. And with all this has happening, there's a tendency for it to exacerbate these symptoms. So we still have them coming. So talk less of when it's over. When it's over and you look around, you're wondering, what next? And you don't know if the next person beside is going to infect you. You don't know how it's going to be, because if the whole place is opened up, there's community spread already. You're walking fearful. Oh, well, God, does this person have? You know, that's another anxiety on its own. So there's no how we are not going to have a high turn-up of people after this is over.
Dr. Arit Esabwedo, thank you so much for being with us.
Thank you very much for
That is an unusual area of aftermath of this, and we'll be keeping an eye on that. Thank you so much for being with us. Now, a quick look at the COVID-19 figures in Nigeria as it stands now. There are 455 active COVID-19 cases, 188 patients discharged, and 22 deaths. That's as at now. This brings the total number of confirmed cases in the country to 665, and that's according to the Nigeria Center for Disease Control, the NCDC. A closer look at the state-by-state breakdown of the cases shows that Lagos has the highest number, the way it has always had, 376, followed by the FCT in Abuja, 89. Kano has 59 cases, Osun 20, Oyo has 16, Edo 15, 12 in Ogun. Katsina has 12, Kwara, Kaduna, and Akwa Ibom have 9 each, Bauchi 7, Gombe has 5, Delta and Ekiti have 4 cases each, Ondo and Borno have 3, while Enugu, Rivers, Niger, Abia, and Jigawa each have 2 cases, with Benue, Anambra, and Sokoto recording 1 case each. Now, one of the states mentioned in that state-by-state breakdown is Kano, where just over a week ago, Kano had just 1 case, and now we're talking about 59 cases. So we go to our correspondent in Kano, Idris Jibrin, who joins us from our Kano studios. Good evening, Idris. What can we get to know? What do you have to tell us? Can you confirm there's this story going around that there were some mass deaths in Kano, about 150 people from an unknown disease?
Well, thank you very much, Ladi. Like you said, 59 recorded cases so far. And regarding the issue of mass death as being circulated, we equally have the story, and we saw it on social media. And earlier today, the Kano State Governor has set up a committee to investigate. It's not official for government, but a committee has been set up to investigate the real cause of that particular death. But I've been talking with some people regarding to this mass death that the people are speculating, like the number that you just called, about 150. Some people are saying that it's not up to 150, and some are saying that it's because of the total lockdown. People decided to be going to one particular cemetery to bury people. That is why people are seeing like it's a mass death. But nevertheless, the state government set up a committee to investigate that particular issue of mass death. But another issue is the issue of the Almajiri evacuation. You know that Kano State Governor yesterday directed the evacuation of over 100,000 Almajiris who are not indigents of Kano State. And that evacuation has started today. Earlier, the chairman of the committee, of course, who is the Commissioner for Local Government and Chieftaincy Affairs, Murtala Garu, confirmed to me that today they have handed over about 419 Almajiris to Katsina State Government, of which the Secretary to Katsina State Government acknowledged the receipts of those Almajiri, and the evacuation will continue subsequently to other states. across the northern region.
Given the number of states that you have now, Idris, the issue of testing centers, are they now adequate for those who are having to present themselves and those that are being quarantined, are trying to come into the state, trying to go out and so on? Are the testing centers adequate?
Well, Ladi, this is one of the major problems that the state government is currently trying to deal with. There is only one testing center. That's the one at the Aminu Kano Teaching Hospital. Even yesterday when Governor Abdullahi Ganduje met with the DG of the NCDC, his main concern is the issue of testing center. The state is appealing to the federal government to provide more testing centers, which the NCDC boasts assured that most testing centers will be provided. But as of now, I can tell you that the only testing center that is in existence in Kano State is that of the Aminu Kano Teaching Hospital, which is not enough. The state government has really confirmed that this one testing center is not enough, given the rapid increasing of the positive cases that are being recorded in the state.
Correspondent Idris Jibrin, thank you very much for that update from the city of Kano. Please stay safe out there. Now, beyond our shores, the UK government has announced it is giving more than £40 million to two British projects searching for a vaccine for the coronavirus. One of them is set to begin trial this week, Thursday to be exact. Imperial College London's Department of Infectious Diseases, one of the projects, is calling for volunteers. It said it is looking for healthy people aged between 18 and 55 years. Successful applicants will be paid up to £625 for taking part. Meanwhile, the death toll from hospitals has risen beyond 17,000. Thanks for staying tuned. Welcome back to the final lap of tonight's program. We go to the British capital, London, where our correspondent, Juliana Olainka, joins us via Skype. Good evening, Juliana.
Good evening.
£40 million. £40 million to go to projects to look for a vaccine for COVID-19 and clinical trials starting on Thursday. What more can you tell us about that?
Well, for the British government, who, might I stress, are under increasing pressure at the moment. You just gave those really dark statistics before the break there. Over 17,000 people in the UK have lost their lives. And if we are to follow data and science, which is what the government here said they have been following throughout this crisis, then it looks as if the UK could be the worst affected country in Europe and one of the worst affected countries in the world. So there are a lot of questions that are being put to the government as to why this has happened. But yes, Matt Hancock, the health secretary, he was overseeing the daily coronavirus briefing this afternoon, and he did announce that rapid progress had been made in a vaccine that scientists at Oxford University and Imperial College London have come up with a clinical trial that is good enough to be tested on the public. This was quite a surprise because over the past couple of weeks, a lot of dominating discussions in Britain have focused on PPE, on face masks, on the death rate. And of course, we know that everybody around the world is scrambling to get a vaccine, but it appears as if they'd kept this in their back pocket, and it will be going out on Thursday. The actual amount that the government will be providing to the scientists is £44.5 million. The lion's share of that will go to Oxford University, and the test that they will be delivering on Thursday will be delivered to about 500 healthy individuals between the age of 18 and 55. There'll be a pool of 1,000 people that they can take the information from. But it's a good thing. It's seen as a good sign. Again, the government are under increased scrutiny, but the fact that we have a vaccine, which, according to our health secretary, is the most funded vaccine in the world, Britain are putting themselves right front and centre as being one of the G7 countries that are putting every single resource into funding a vaccine. And so, hopefully, fingers crossed, this will work.
In just under 30 seconds to 45, because that's all the time we've got left, what's the general situation on in the British capital about the lockdown, how people are moving around and all of that?
It's such a tricky one because, depending on who you ask, it's, are you a head person? Are you a heart person? I think, of course, if you speak to businesses, if you speak to a lot of people that like making a lot of money, they want the economy ticking again. But then, of course, if you've lost a loved one or you're a vulnerable person or you fear the coronavirus, as you should, you will want these lockdowns to last longer. But they can't last longer because, of course, we know that Britain is suffering. All of the data shows that the economy is on the brink. We're heading into a deep recession. The thing that could tell that is when these lockdown measures are lifted.
Thank you very much, Juliana Olayinka, our correspondent reporting there from the British capital of London. Thank you so much, and do stay safe out there. And that's how we wrap up our COVID-19 special at this time. Thanks for being with us. Do join us tomorrow when we'll have more updates at 12, at 6, and at 9. Good evening.